In sepsis, we give fluids, we give antibiotics, we follow the protocol. But here's the moment that matters most. What do? To understand this, you only need to remember one thing: a bucket and a sponge. The bucket is circulation. The sponge is lungs. If you forget everything else, remember this. What happens when the patient gets worse anyway? The bucket holds volume, the sponge is light and dry, blood flows, oxygen crosses, everything works, system stable. Now sepsis begins. The bucket starts to empty, vasodilation, leaky vessels, so we do the right thing, we give fluids. And early on that works. But look closer at what we're giving. Fluids, antibiotics, blood, it all adds volume. Everything fills the bucket. At the same time, the lungs are changing, infection spreads, inflammation builds, the sponge gets dirty, oxygen starts struggling to cross.
Now comes the turning point. You keep giving fluids because the pressure is low.
But now, the bucket is getting full, and the sponge is getting soaked.
This is where people miss it. The bucket is no longer empty. The sponge is no longer usable.
Now, oxygen cannot cross. Flow is ineffective. The system is failing. Breathing faster. Oxygen needs rising. Confusion worsening. Urine dropping. Skin cold, clammy. This is not just low blood pressure. This is failed perfusion plus failed oxygenation. The monitor says blood pressure is low, so we respond, give more fluids. That's the trap. Because now, you're not helping the bucket, you're drowning the sponge. This is where thinking changes. If the bucket is full, fluids won't fix it. Now you must escalate care. Start vasopressors. Support oxygenation. This is about flow, not volume. Ask the only question that matters. Why is the patient still in shock?
Heart failing, infection overwhelming, lungs failing, flow blocked. If you don't ask why, you'll keep treating the wrong problem. You can fill the bucket. But if it's already full and the sponge is soaked,
more fluid isn't the answer. The answer is why?